if your T3, T4 starts to go down, that means your gland is underactive. Okay, so that means your pituitary starts telling the thyroid to make more T3, T4. Okay, that means the TSH starts going up, it increases. Then that condition is called as hypothyroidism. Okay, and when the reverse happens, when the gland is more overactive and the pituitary is telling the gland to relax, so the TSH is going lower and lower and lower, the T4 specifically goes higher and higher, is called hyperthyroidism. So those are two types. Of course, there is a condition which is called as subclinical hypothyroidism, which means that the TSH has started going up, but it's not very high to really, give some very specific medication. But if the symptoms start coming, then you have to think about medication for subclinical hypothyroidism also. And then there is something called as a goiter. If the thyroid gland becomes bigger in size, it's called a goiter. Now, when you say goiter, it can be normal thyroid also, or the thyroid can be hypothyroid or a hyperthyroid also. Okay, so there are 4 kind of conditions, but hyper and hyper are the hypothyroidism is the most commonest. And then after that, we have hyperthyroidism. It's very difficult to really talk about the causes per se, because you might not be able to really find a cause for thyroid, hyper or hypo. But yes, it is more common in women. Women are at higher risk. Why that is happening? Probably it's a little unsure. So I don't want to go there. But women are at a higher risk of getting hypothyroidism. Now, initially, many years back, the cause of the hypothyroidism was actually lack of iodine in the diet. So before the white salt got fortified, it was actually the lack of iodine. Now, of course, with the fortification which has happened, which I still recommend that we use the white fortified salt. But anyway, now that is kind of taken care of. Now, the most commonest cause we can say for hypothyroidism specifically is actually something called as autoimmunity. So if you have something called as Hashimoto's, if your hypothyroidism is autoimmune, that is one of the most commonest causes. Other causes, like you have treatment for hyperthyroidism. So normally we have medications for hyperthyroidism also, but eventually when you have to treat it, you can burn the gland a little bit with something called as a radioactive iodine. Okay, or people undergoing surgery for thyroid for things like cancer or something can eventually get pushed into hypothyroidism. Okay, then there are other reasons like immunotherapy, some form of chemotherapy can push the person into hypothyroidism. Common, it's not very common, but yes, medications also, especially something called as lithium, can push the person into hypothyroidism. So some reasons can be found in some cases, not all cases. And having a family history can predispose you to getting hypothyroidism more commonly than hypothyroidism. The problem with diagnosing hypothyroidism specifically is that the symptoms are very vague. You can have fatigue, lethargy, tiredness, weakness, which could be because of other causes also, like vitamin D deficiency, another very common cause. Okay, so we have to look at the symptoms also, clinical picture also, but then we have to test also. Okay, other things like you have changes in your heart rate. So because your thyroid gland is a metabolic gland, it has other functions like it controls your heart rate, it controls temperature. All these things it does. It's very important for conceiving, irregular menses. So people who are trying to conceive, if your thyroid is not under control, it becomes very difficult to conceive. Sometimes untreated thyroid can push you into something like infertility also. So these become another, think about thyroid. Is it, worth checking or not? Especially if you're, having difficulty conceiving. Sometimes you feel very cold. Everybody around you is actually pretty okay, but you're feeling more cold. So that's could be a symptom of hypothyroidism. And sometimes you can have, everybody's okay, but you're feeling more hot also, which could push you into, could be a sign or symptom of hyperthyroidism. Okay. Now, honestly, this is not really exact for everybody, but these are few of the commonest things that can happen. Another thing is constipation. Now, because thyroid has a role on the gut, okay, especially how the intestine moves. So if you're hypo, that means your intestine can become a little slower. So you can get pushed into hypothyroidism. Okay. If it's a little faster, then you can get pushed into looser motions also. Okay. So that can happen. You can pass multiple motions, like motions multiple times in the day also. Okay. Then other things like puffiness, weight gain, weight loss. So weight gain is commonly seen in hypothyroidism. weight loss is commonly seen in hyperthyroidism. There is a smaller percentage of hypo patient who can lose weight also, and there's a smaller percentage on hyperthyroidism who can put on weight also. Okay, so that can happen. General people have so much information about it already. The fear is already there. So the minute you get a stamp, your doctor said you have hypothyroidism, or you have Hashimoto's, or you have hyperthyroidism, you start kind of making up everything in the head that you've heard of. Your neighbor said something, your relative said something, your parents said something, you read something. So it kind of impacts you more than the disease itself. Okay, like I said, sometimes feeling low, feeling lethargy is a symptom. Now, because you feel low, weak, tired, you don't even want to go for exercise. You don't want to, cut that extra salad and eat, which creates a different kind of impact even on the mental health. So when this comes along with thyroid, plus the impact of having a disease which you feel, or which your doctor might also tell you, okay, you have to take medicine for life. If you that one pill that you have to take in the morning, if you keep that, if you hold it very strongly, then you start going down. So if we tell people that you might get out of the medication, I'm not saying everybody can, but you might, if you can rectify your lifestyle. Okay, there's a chance that people will start taking care of themselves. And mental health and physical health has to go hand in hand. I cannot say only mental health or any physical health. It is a two-way street. So if we work on both the aspects, then the mental impact starts to reduce, which will encourage the people to take action to improve even the physical health. One issue from a hyperthyroidism perspective is actually two things which are very common in hypothyroidism. Is one is a palpitation. What is palpitations? You can hear the heart beating a little faster, and you can literally hear it out of the chest. You feel it's coming out of the chest. Okay. And second is that tremors. If you just put your hands out a little bit, you can have tremors. Okay. So these two symptoms of hyperthyroidism, uncontrolled hyperthyroidism, can actually make the person feel more anxious and more nervous than already the person is. So that has a direct impact in hyperthyroid patients. These chronic conditions, especially, hypothyroidism. But yes, if you ask me about management of hypothyroidism, it's 100%. It can be managed, and it is managed quite easily. From a medical aspect, you have one medicine which you need to take. If you need it, you need it. And from a lifestyle aspect, there are many things that you can do to rectify the quality of life, the overall lifestyle aspect, which will support your thyroid gland. Okay, so hypothyroidism either way can be managed quite easily. When you talk about reversal, we have to define actually what is reversal. Reversal of hypothyroidism means that you were started off on medication, okay, and now for some reason, for whatever changes you've made, you've managed to wean it under your doctor's guidance, of course, and you're off the medication. Okay, not reducing, off the medication. Once you go off the medication, how long can you stay without medication is what is eventually going to be defined as thyroid reversal. Okay, hypothyroidism. Okay, when it comes to hyperthyroidism, you actually can, in a way, say that you can cure hyperthyroidism, because things like I mentioned in the beginning, radioactive iodine, where you're burning a part of the gland, or if you go for some form of surgery or something, technically you have cured the hyperthyroidism. The only problem over there is you have pushed the patient into hypothyroidism. Okay, so that way it's a gray area, right? You've cured one thing, but you've gone into another thing. Of course, having said that, hypothyroidism is much easier to manage as compared to hyperthyroidism, because dose fluctuations, medical dose fluctuations, can happen more often in hyperthyroidism than hypo. So if you can manage hypothyroidism first, if it's not getting managed, then you have to think about treatment from a radioactive or other perspectives. Basically, hypo easy to manage, cure we wouldn't use. Hyper sometimes difficult to manage, so you need to go in for something like a surgery or a radioactive iodine, which will finally cure the hyper, but you will go into hyper. Someone is very, very adamant, and normally we say that the TSH needs to be between 0.5 to 5. Okay. Now, when you say you want to diagnose hypothyroidism, okay, that means the TSH starts going above 5. Between 5 and 10, you can say it is roughly subclinical hypothyroidism, unless the patient is having too many symptoms, or if the patient wants to conceive, then it's a different, the range is very different. When you're talking about a pregnant lady, thyroid becomes important not only for her, but for the unborn baby. So the ball game completely changes. Okay. But when you're talking about general public, between 5 and 10, medical treatment might not be very, very necessary immediately. Okay. But if your TSH is rising, 10 became 12, 15, 20, 50, 100, 150, and you're refusing to treat it. Okay. Of course, you will have symptoms, but I said the thyroid symptoms are very vague. So sometimes they might get missed, or sometimes people just live with the symptom. In such scenarios, first most important issue is your bone health. If your thyroid, even hyperthyroidism, if your TSH is going lower and lower and lower and you're not treating it, your calcium starts coming out from the bones. So things like early osteoporosis. What is osteoporosis? Your bones are becoming brittle and hollow. Okay, so that is one of our biggest concerns when it comes to thyroid. So one is bones, very, very important. Second is because the thyroid has a role in cholesterol, that is a fat metabolism, lipid metabolism, your cholesterol can start increasing a lot. And then we know and we accept that now. Of course, we are not looking at how much cholesterol and what are the numbers right now, but it is a predisposing factor or a contributing factor to heart disease or stroke, especially if you already have thyroid, blood pressure, or diabetes. Okay, we are not saying cholesterol is causing it, but it is contributing to heart disease. Okay, then you have infertility. You're trying to conceive, you've done everything. Sometimes even things like the assisted reproductive techniques like IVF, IUI might not be able to help you because your thyroid is uncorrected. Okay, then you talk about, if you are talking about pregnancy, if you don't correct your thyroid, then birth defects in the child, the poor growth development of the child, brain development of the child gets very, 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 very easily affected. Okay. And then, of course, things like constant weight gain pushing you into obesity. These are things that we really need to kind of take care of from a hypo perspective specifically. From a hyper perspective, predominantly it is the bones, it is the impact on the heart. It's very, very necessary that we control hypothyroidism to protect the heart also. So if these two things can be done with awareness, then the person will not have to go through any of these complications. Maybe you cannot prevent every person from getting thyroid, but you can postpone it. If you are predisposed, family history is there. If you are predisposed, it's okay. Don't take it as like, Merko to, I am going to get thyroid. Never think like that, especially hypothyroidism. Okay. Do your part. So when you say try to prevent or try to postpone hypothyroidism specifically, hyper is a little different. It can be a viral infection can happen. You can go into something called as inflammation of the thyroid, which can push you into hypothyroidism. So that's a little more complicated. But let's say hypo lifestyle is most important. So you talk about first is exercise. Now, normally people say food is first, but for me, exercise is first, because one of the easiest ways to rev up your metabolism is exercise. What is metabolism? Metabolism is how quickly whatever you're eating, how quickly you can break it down and digest it. Okay. And because thyroid is controlling that, if you give that support to thyroid, the load on the thyroid goes down, right? Because the exercise has taken the load, it is increasing the metabolism, the thyroid can relax. See, anything you want to get better, if we get hurt, if we keep irritating it, it will not heal, right? So you have to give it some rest. So if you can just relax the thyroid gland a little bit, there is not, of course, you can't relax it the way I'm giving this example, but if you can remove the load a little bit, then the chances of prevention, postponing it, or reversal or managing it becomes higher. So versus exercise, okay, 30 minutes of walking combination. There are a lot of yoga asanas which can help activate the thyroid gland. Very, very specifically, whatever that stretches your neck upwards. This movement, there are a lot of asanas. You have Bhujangasana, you have something called as fish pose, which makes your neck go upwards. You don't know yoga, just sitting, do this. So you can, it's not like 100% it will work, but these are all things which help you activate the gland a little bit. Okay. So yoga as a combination of cardio is excellent. It could be 30 minutes, 40 minutes, 4 times in a week, 5 times in a week, but it needs to be done. Okay. Then of course you can't keep sitting through the day. If you're sitting through the day, your metabolism is going down, your belly fat is increasing, which is again a problem. The load is picked up by the thyroid. So you have to get up every hour, walk a little bit, stretch a little bit, come back and resume your work. Then you talk about food, which can help the thyroid in a way, especially things like zinc-rich foods. Pumpkin seeds are there, selenium-rich foods are there, Brazil nut is there, sometimes wheatgrass you can use. Okay. Then you have something called as L-tyrosine, which is actually easily available in dairy products. But some people are not okay to have milk. So if you're not okay to have milk, I'm okay. But if you can have a little bit of paneer, like once a week paneer, you can have curd, one bowl of curd a day, or a glass of buttermilk, something like this will actually help you. Of course, anything that I'm telling, if it causes a issue to your stomach, if your gut health is affected, then don't do it, because gut health will eventually irritate the thyroid. But if it's not, affecting you, but you read about it or you heard someone talking about go dairy free, go gluten free, it's not necessary. Okay. Then you have, a little bit of coconut oil can help the thyroid gland. But if your oil intake is already very high, then that coconut oil will not really impact you. I mean, rather it could cause other issues. So you have to moderate your overall oil intake, and in that you have to take the coconut oil, or then you start cooking a little bit in coconut oil and include that in that process, basically. Okay. Then we hear a lot about don't have cruciferous vegetables. That's actually very harmful to the immunity of the body also. You should have cruciferous vegetables like cabbage, cauliflower, broccoli, but the only thing is cook it. Don't have it in the raw form. So you can saute it, you can make it a vegetable. Don't have it in the raw form. That's all that you have to do. And last but not the least, from a food perspective, is I think white iodized salt. People shifting to senda namak, pink salt, rock salt, black salt, they have their own advantages. I will not deny that they are less processed, agreed, but they still don't have enough iodine. You need that iodine specifically with family history, women, pregnant women, children. A lot of children are taken off white salt worry of under the worry of processed. But that's not a good idea. You can keep the process to one side, but fortification is what you have to remember. So at least half a teaspoon in the cooking that you're doing needs to be white salt. Uske upar, whatever you want to put, that's a different thing. But include white salt. So food is something which makes a huge difference to in fact, any cell in the body. Of course, you're eating it, right? So it is important. Packaged food. Okay, now we're talking about sugar. Why is sugar so important? Because packaged food is full of sugar and salt. If sugar is not there, there are sugar additives. And believe it or not, sugar additives are what irritate the liver health more than anything else, not even sugar. Then comes your sleep. I will sleep only for 4 hours. I have too much work. I will sleep only for 5 hours, 3 hours. I will compensate in the afternoon. Doesn't work. Okay. Sleep is the time where everything goes into recovery. Everything goes into repair work. Okay. Abhi, if your highway, if you try to repair it in peak hour, no repair work will happen. Okay, so you need that night time where there are minimum cars. So you need that time, quiet time, basically. Same way you want your body to recover, you want your diabetes to recover, you want your thyroid, you have to sleep properly. Because thyroid is your metabolic gland. It is talking to growth hormone. It is talking to other hormones like insulin in the body. So when everything is relaxed, that is where you reach a status of relaxation when you're sleeping. So prioritize good quality sleep, at least minimum 6 to 7 hours in a day. You can go to 8 hours, no problem. Beyond 8 hours, you don't really need more, 9 hours, 10 hours of sleep either. So 6 to 8 hours is a good, like a target to have, basically. All right. Last but not the least, predominantly, of course, there's alcohol, which will really irritate the gland. Smoking is a strict no-no. Whether you're talking about hypo or hyper, smoking can worsen all your symptoms, especially heart palpitations, and also be extremely careful. It can irritate the gut even more. People depend on smoking just to pass motions, So be very careful with smoking. And last but not the least is your stress levels. I think everything that I spoke about is eventually controlled by your stress and what happens in the mind. If you're not feeling good, if you're too stressed, I don't feel like doing this, I don't feel like doing that, I know I have to go for a walk, but I don't want to do it, or I'm not being able to take out the time to do it because I have so much work, or I have family, or I have a child, So if we can understand our stressors, what is it that is making us go away from a better lifestyle, and then work on those whys. Okay, why am I not doing this? Then I think thyroid reversal, management, everything is, in your hand. Medication, yes, that small medication is there in the morning, but if you can up your lifestyle, then the dependency on the medication can go down.